Hello, I'm Dr. Kalyan Varma, Professor of Forensic Medicine and Toxicology. This is gonna blow your mind. The big four snakes in India are cobra, which includes the common cobra, Naja naja, and king cobra, Ophiophagus hanna. Crate, the species commonly found is Bungarus caeruleus, Russell's viper, scientifically known as Daboia russelli, and the saw-scaled viper known as Echis carinatus. What is the similarity between the common cobra and the king cobra?
Both snakes have a hood. The third labial scale touches the eye as well as the nasal field. What are the differences between the common cobra and the king cobra? Well, the common cobra is smaller in size, typically 1.5 to 2 meters long, and has a spectacle mark on the underside of the hood. On the other hand, the king cobra is larger in size, typically 2.5 to 4.5 meters long, and does not have a spectacle mark on the hood.
Which snake builds a nest? The king cobra, Ophiophagus hanna, is unique as it is the only snake in the world that builds a nest, which is the largest venomous snake in the world. The king cobra, Ophiophagus hanna, is the largest venomous snake in the world, reaching up to 5 meters in length. It is also ophiophagous, meaning it primarily preys on other snakes, especially rat snakes. What is the difference between the bite of a non-poisonous snake and a poisonous snake? Non-poisonous snake bite typically leaves a characteristic U-shaped set of teeth marks. Poisonous snake bite usually leaves 2 distinct fang marks, which may sometimes be difficult to see. Now let's discuss some steps to identify a venomous snake. For belly scales, if the scales are small and do not cover the entire breadth of the belly, the snake is non-venomous. However, if the scales are large and cover the entire breadth, the snake may be either venomous or non-venomous. For head scales, if the scales are small, the snake is likely venomous, such as vipers. If the scales are large, the snake may be either venomous or non-venomous. Looking at the side of the face, if there is a pit between the eye and nostril, the snake is venomous, characteristic of a pit viper. If the third labial scale touches the eye and nasal shield, the snake is venomous, like cobras and coral snakes. Lastly, other features to note include the central row of scales on the back. If it is enlarged, and there are only 4 infralabials on the underside of the mouth, with the fourth being the largest, the snake is venomous, typical of a crate, which also has bands or half rings across its back. Venom versus poison. What is the difference between a poison and a venom? Well, venom is always injected by a bite or sting. On the other hand, poison can be injected or applied locally. Let's talk about the classification of venomous snakes. How are venomous snakes classified? Venomous snakes are classified based on the characteristics of their venom. Neurotoxic venom affects the nervous system, with examples including the cobra, such as the common cobra and king cobra, the crate, and the coral snake. Vascular toxic venom affects the blood vessels and blood cells, seen in vipers like Russell's viper, saw-scaled viper, and pit viper. Lastly, musculotoxic venom affects the muscles, a trait found in sea snakes. Now, on to other important points. Which snakes are viviparous? Vipers. They give birth to live young instead of laying eggs. What is a dry bite? A dry bite is a bite from a venomous snake where no venom is injected. About 20% of viper bites and a higher percentage of bites from some other snake families, up to 75% for sea snakes, are dry bites. What are the differences between a cobra and a viper? Let's compare. Body-wise, cobras are long and cylindrical, whereas vipers are short and stout. Cobras have a small head, the same width as the neck, while vipers have a larger, broader head than the neck and body, and it's triangular. Head scales on cobras are large, while on vipers they are small. In the upper jaw, cobras have 2 fangs plus other teeth, but vipers have only 2 fangs. Fangs on a cobra are short, fixed, and grooved, while those on a viper are long, mobile, and canalized. Cobras have a round tail, vipers have a tapered one. Pupils of cobras are round, but those of vipers are vertical. Regarding venom, cobras produce neurotoxic venom, and vipers produce hemotoxic venom. When it comes to reproduction, cobras are oviparous, laying eggs, while vipers are viviparous, giving birth to live young. Let's discuss the first aid measures for a snake bite. What are the first aid measures for a snake bite? First, reassure the victim. Inform them that not all snakes are venomous, and most snake bites are non-venomous. Even venomous snakes may not inject a lethal dose of venom. This helps to reduce anxiety and fear, which can increase heart rate and speed up the circulation of venom. Remove any constrictions such as jewelry, watches, rings, bracelets, or tight clothing from the bitten limb to prevent constriction as swelling may occur. Arrange for rapid transport of the patient to the nearest hospital where antivenom is available. Immobilize the bitten limb using a splint or sling to slow the spread of venom. How many antivenom vials are required for a single patient in a case of snake bite? Start with 10 vials of antivenom. If symptoms do not improve, administer another 10 vials. Most cases require 20 vials, but in the case of Russell's viper bites, up to 30 vials may be needed. How is antivenom reconstituted and infused? Take an antivenom vial. Add 10 milliliters of sterile water or normal saline provided with it. Prepare a total of 10 reconstituted vials, resulting in 100 milliliters of reconstituted fluid. Dilute this 100 milliliters of reconstituted fluid with 100 milliliters of normal saline to make a total of 200 milliliters solution. Administer this 200 milliliter solution as a slow IV infusion over 1 hour.